the best thing you can do for this tightness and weakness is get the outside of your hips stronger. So clamp.
Hi, thanks for joining us today. I am Andee. I am a group fitness instructor from Salt Lake City, Utah. I teach in a studio setting as well as help clients online with their healthy lifestyles and fitness, help people in the US, in Canada, and in the UK. I am here with Brad today, and we're talking about some common weaknesses and tightnesses that I see in my clients. Brad, why don't you tell us a little bit about yourself?
Yeah, you guys, so excited to have all of you here with us. We've been doing these videos for a while now, and we're going to keep putting them out if you guys are enjoying it, if the information's helpful. But some of you are new, so I'm Brad. I'm a physical therapist. I'm also based out of Salt Lake. I have an outpatient physical therapy clinic in West Jordan, and we do a lot of stuff online as well. And we're excited to talk to you guys about different kinds of ailments that affect actually everybody every day. It's just whether they notice or not.
Awesome. So like I said, I work with clients all over the US and Canada and the UK, and I've noticed a pattern. When it comes to men and women, there seems to be different tightnesses or weaknesses. I guess, and weaknesses, tightnesses and weaknesses. I see the very, very common in women seems to be more to do with our bodies after we have babies. And also just our tight hips in general. As women, we're very tight in our hips. And then with my male clients, it seems to be a lot of shoulders. They also have tight hips, but it seems to be more upper body is tight for them. I don't know, is that something to do with male versus women?
So there's different factors that tie in with this kind of thing. Like we talked about in the last video, our bodies are just mechanical machines, right? So let's look at the male versus female body, but then let's also look at just human bodies in general. The big concept here is what posture are we putting ourselves into? So if there's a lot of, I've actually had a lot of females with shoulders as well, more kyphotic, so that's where the upper back curves forward, right? Yeah, exactly. And you get that, have you noticed with any of your clients that bump right at the base of their neck?
Yeah, it seems to be like right here.
Yeah, and so there's a bump there and everybody has it. It's just not supposed to be very large, right? It's a bone. It's your C7, T1 vertebrae stick out right there. And if your head is too far forward, if your shoulders are rounded and the back's kyphotic, then that bone's gonna stick out more, and then it can have other problems when it's that way for too long. Right. But that's a tangent. I'll try to stay off of that.
I was just thinking that.
What was that?
I was just thinking that because the world we live in, where we're always on computers, we work at a desk all day, and I feel like it leads to that.
Yeah. So we'll definitely have to make another video about that because we could go on forever and how that causes headaches and stuff. So, but let's talk about the tightness that we're talking about today. Let's start with hips, okay? When you look at the female pelvis versus the male pelvis, this is one of the largest differences. The female pelvis is wider, and it's wider for one very specific reason, so that a baby can fit through, right?
Yes.
Even if you haven't had kids, it's still wider. If you've had kids, now it's a little wider and looser because of the laxin, right? That's released so that your ligaments are looser. But with a wider hip, wow, sorry, with the wider hip base, then our legs are out here, but our base of support is in here. So a lot of women, their legs come in. And then in addition to that, have you as a woman ever been told modesty means that your legs are close together?
Yeah.
So
I've never thought about that.
Legs,
yes.
Wider hips, and we force them together. Now what's going to happen? And this is called the crossbody syndrome. This happens all over our body, but in the hips, you're going to get weak on the outside and super tight on the inside.
Yes.
So that if you notice, most women, if you touch on the inside of your higher up towards your groin, those muscles are going to be very, very tight, because our body is like a broken clock. It's only right once a day or twice a day. Our body's only right in this one position, but it doesn't care it's not falling. So the body gets really tight to hold in that position by tightening up the adductor muscles, because the outside muscles aren't strong enough. So the best thing you can do for this tightness and weakness is get the outside of your hips stronger. So clamshells, leg lifts, bridges, stuff like that.
So would you say that our lifestyle leads to those, on top of our genetics and our different makeups, would you say our lifestyles lead to those common tightnesses and weaknesses?
Absolutely. We sit way more than we did centuries ago, right? Because you can access everything. Would a personal trainer, a fitness trainer, sit as much as you do coaching online 100 years ago? No, because they couldn't coach online, right?
Yeah.
There's TV, there's our office jobs, all of this stuff that makes us sit more. And so sitting is one of the best ways to get your butt super weak. And that's why I love the term lazy butt, because
It fits right in.
that's what's happening.
I love that.
So what we're doing now has a huge effect on that. And I don't know, I haven't studied injury history way back 200 years ago. What kind of injuries were they having that are different now? But I just know from our sitting habits, from our posture habits, that we're having those problems now.
Absolutely. So this video is probably going to be more women focused, because that's the majority of my clients are women. I have a few men that I work with, but most of them are women. So the most common complaints I hear during squats and lunges and burpees is that they can't do it because they pee their pants. I mean, I don't know how to say that more like professional, so I'm just gonna put it out there.
That's the thing, when we're talking about this stuff, people need to be okay talking about it. They're human bodies, right? In my clinic, I have conversations all the time with women more than men, but with anybody, it's a human body, it's a machine, right? And so you have to realize, why are we having a hard time controlling our bladder during a squat or a jump, something like that? It's normal, right? It's normal, we're gonna be that way. No, not at all. Most women I talk to tell me like, oh, I'm 70 years old, of course I pee my pants. Like, no. Now, when we get older, it's gonna be harder, and obviously way harder for women than men. But why is it happening? And the number one cause is not weakness, like most people would think.
Interesting.
On the floor, I can't control my bladder, or I pee my pants when I'm doing a squat, is because the pelvic floor is too tight.
Oh, look at that.
So
It's like the opposite of what we're always told.
Right. So you're told do Kegels, right?
Yeah.
And
I've explained, because so often they're like, well, I had a baby and I've worked on these muscles and I've done my Kegels, and I guess it's just a mommy bladder thing. And so that explains, they're like, I've done everything I'm told to do.
Yeah, and there is trauma. There are some women who have had enough trauma from having a baby where they've ripped and they've not been able to heal, and it's possible that they won't be able to completely recover from that or completely control it. Sometimes it is weakness, right? But if the muscles are still there and they're aligned properly, then even at later stages in life, we can control our bladder.
Interesting. That's so like.
It's good to help people. Hopefully some of your clients, some of my patients out there will see this as new information and they can do something about it.
Yeah, absolutely.
If you have a pelvic floor problem, I'm not the guy to go see. That's not my specialty. I can teach you about it, but you need to find a pelvic floor specialist, a physical therapist who is specially trained in that. They can show you how to check if you're tight yourself. They'll actually check for you sometimes. They will show you everything about it. They're just like any other muscle in your body. You have muscles there that sometimes need treatment.
Yeah, and I think that's cool to point out that there are specialists that do work with that, because I even myself, like, I didn't know for a long time that there was a specific physical therapist that focuses on that specialty. That's so cool to point out.
Well, and the sad thing too is, who's your number one doctor for pelvic floor stuff? An OBGYN, right? The majority of OBGYNs that I've talked to, and I've talked to at least 24 of them, and majority of them, when I specifically asked, because I was looking for an answer, I said, what do you do when a woman has a hard time controlling her bladder during exercise, or she has pelvic floor pain during sex, or any of those other things? And they said, well, just give it time, or here's some pain medicine and muscle relaxers. Because even as an OBGYN, a lot of them don't know that there's someone who is specially trained in that. Physical therapists who do pelvic floor know more about fixing that problem than any OBGYN out there.
Interesting.
So you might have to advocate for yourself. You have to go and seek that out, because your OBGYN might not recommend it.
Yeah, and that's something I talk about a lot with my clients in general, is educate yourself. Don't be afraid to do some research. Don't be afraid to question information and look into it more. Don't be afraid to look at other sources. Do some research, look into it.
Yeah. And be careful with Dr. Google, right?
Yes.
But definitely get several opinions. When you find something online and you're like, this makes sense, or I saw a YouTube video where Dr. Brad was saying that I'm 70 and it's normal. Well, maybe Dr. Brad is wrong, right? It's okay to seek out several physical therapists, seek out a couple OBGYNs. When you're dealing with something like this, get a couple opinions and then find what works. If it's not working, then it's not the right answer.
Yes. And the other thing is, don't be afraid when you do go to a specialist to say, I've heard this or I've read this. They hear that a lot and they're not going to judge you for it. I think I've heard from people before, like, I don't want to tell my doctor that I think this is the reason, or I don't want to tell my doctor that I've heard that I need to do this. I don't want to think I'm crazy. Like, not the case. Don't be afraid.
Absolutely. And you have to approach it the right way too, because I have clients who will come in and say, I tore my rotator cuff. And I'm like, oh, okay. Who'd you see? Who told you that? Well, no, I did some research online. Immediately, it's like, okay, that's great that you've done your research, but here's what I think's going on. As soon as you're like, no, you're wrong, it's the rotator cuff. And I say, okay, well, I'm trained to find what it is, and I told you it's not, and you're not willing to listen. There's nothing wrong with going with information. And if your doctor's not willing to, if you're like, man, I feel like my headaches are coming from my neck being too tight, and your doctor's not willing to listen and just says, take this migraine medicine, and get a new doctor. But at the same time, you need to be willing to listen too, because if your doctor says, look, we've checked your neck, it's not tight. We've checked your posture, you're fantastic on posture. Your headaches aren't coming from that, but we checked your blood pressure and it's crazy high. You need to realize that maybe what you heard from Dr. Brad, where a lot of headaches come from, tightness, right? I'm just using this as an example. Hopefully it's not too much of a tangent.
No, I love it.
Realize that your doctor can rule things out and give you another opinion and listen, just like they need to listen to you.
Yeah. I do feel like we've touched a lot on women, so I do want to touch on the men a little bit. With my male clients, I would say the tight areas that I see are often hamstrings, shoulders, and hips.
Where in the shoulders?
It usually seems to be like upper back shoulder, like in the scapula. More so.
Yeah. So a big thing for men is that they shrug their shoulders a lot, right? Mm-hmm. And so it's going to be upper trap dominance. If you look at your trapezius muscle, there's 3 sections, the upper, middle, and lower. And we need to train the middle and lower trapezius to do their job to stabilize the shoulders way, way, way better. Because the upper traps is just dominating and doing everything. And a lot of that comes from posture and poor lifting technique.
Yeah, that makes sense. I think that I notice the most like when we're doing stretches, like arms across here, it becomes like down here, and like this becomes like this. Like there's that tightness there.
Absolutely.
So yeah, that makes sense. And then like I said, hamstrings and hips, and I think that's a lot of that is. This is just me guessing, but I think a lot of it is men tend to, from what I've seen, focus on the flexibility of their lower body a lot less than women tend to focus on their flexibility of their lower body.
Absolutely. If they're exercising at all, do you think they're stretching their legs? Like, no, legs is a woman thing. Men is like, look at my guns.
Yes, exactly.
So a lot of it also comes, though, from what kind of work are they doing? Where some women who are stay-at-home moms might be up and down with kids, whereas a lot of men with desk jobs, right? Yeah. And I'm not trying to be sexist at all. There are women out there with desk jobs screwing up your hamstrings too. Don't feel left out. But a lot of men with their sitting jobs will have tight hamstrings or poor lifting, what's the word? Poor lifting technique, because they haven't worked with Andee to learn how to lift properly yet. Yes. So they're out there lifting poorly, lifting with their back or with their ignoring their glutes altogether, so the hamstrings do all the work, right?
Yeah. Well, awesome. I know we've touched on a few tightnesses and weaknesses in men and women, and if there's one that we haven't addressed that you maybe have some questions on, reach out to us. We are happy to talk some more with you guys.
Absolutely. Thanks for being here, guys. And we're having a lot of fun adding to your journey as you're headed back to fitness and activity.
Yes.
So just to put a shameless plug out there, I'd love it if you guys would find me on Facebook, Dr. Brad Physical Therapy, or on YouTube. I put up different videos there. And then I also post 2 to 3 times a week on my company Facebook page. So that's Rocky Mountain Therapy Services in West Jordan.
Perfect. And you can find me on social media at Andee the Fitness